So is it possible to go to NP school and have a baby? It absolutely is possible. I had both my kids in the DNP program, not to mention I had preeclampsia, was on blood pressure medication for 6 months, okay? And in the acute care program that I did at UPenn, there was a streamlined program, which was a year. And I did that program with a 5-year-old and a 3-year-old. So you could imagine that wasn't easy. But again, it can be done. So for all of you who are new to my page, welcome. It's your favorite NP mentor here. Just a little bit about me. I have my acute care nurse practitioner certification, and I also have my adult gerontology primary care certification also. So enough about me. Let's get into this video. So the first thing you want to do is you want to assess your financial situation. Now, if you work in like 2-3 jobs, I could tell you it will be very, very difficult to try and go to NP school. What's going to happen is you're going to sacrifice your grades for your job. So the key is making sure that you have enough time to study, which will mean likely you will have to come down to one job. And even with one job, you're going to feel a little bit overwhelmed. And I can tell you that's absolutely normal. Now, of course, when you have children, putting that into play with work and study, that makes it a lot more difficult. Combined now with if you have 2 jobs, that makes it all the more worse. So we want to make sure that you have one job, because then that will increase the likelihood that you're going to pass. And that's what I'm trying to help you to do. All right. So number 2, you're going to go part-time in school. Now, the NP program is very, very flexible. You do not have to worry about going full-time, because you can actually go part-time and you can take your time and finish at your own pace. Now, I know everybody want to be done and they just want to be done with school, but the key is to make sure that you do well in the program and that you don't rush the process. Trust the process. So Eric Thomas tells me, who I love, by the way. Anyway, so you have to make sure that you pace yourself. Now, if you are at home and you have children or a child and you live with your parents and you don't have to work, or whatever the situation is, you might be able to get away with not having to worry about financial stress, because you are living with your parents, or you're living with a husband who's paying all the bills, and you may be able to go at a full-time basis. But let's say you're not in that situation. You're a single mom, or you're married, but you need to work and you cannot go on a full-time basis because you have other obligations. That is absolutely positively okay. You do not have to worry about that. All right? So you can go part-time, especially if you work at a hospital already. What you can do is you can utilize the hospital's tuition reimbursement, right? So once you have tuition reimbursement, that will allow you to be able to pay for school, at least whatever they give you. You know, it's not no big set of money, but at least it's enough to get you started. And you can pace yourself. So I had a friend who wanted to utilize as much tuition reimbursement as possible. This took a long time. So what she did was she went to school and she did it slow. Now, the hospital where I work, they would give you $5,000 a year. So she would somehow squeeze that $5,000 for the year, because if you take all the classes in 1 year, for example, you're only going to get $5,000. But let's say the school is 4 semesters, right? If you spread it out over 4 years, which a lot of people may not want to do, you spread it out over 4 years, then you'll be able to get $20,000, right? Instead of only 5. So you can work the system however it works for you. If you want to spread it out, if possible, so you can get your tuition reimbursement like my friend did, by all means. But for me, I just wanted to be done. I really didn't want to be in school any longer than I had to, so I opted to just pay everything up front right away. Got my $5,000 and whatever was left over, either I took out a loan or I just paid it. And that's how I did it. But you have to assess your own financial situation and decide whether or not going on a full-time basis will put a strain on you, because if it does, I would suggest you just go part-time. It's okay. Take your time. The NP program can be self-paced. There is no rush. You do it at your own pace. And that would be my advice to you, rather than trying to rush through it and then either not do well or just be overall overwhelmed. And NP school is already overwhelming, because with clinicals, finding a preceptor, that is already a lot of stress, much less now you're working extra hours and you're going full-time. So all those things combined can make it a lot more difficult than it really needs to be. So consider going part-time. It is okay to do that. Go at your own pace. And if you are enjoying this video so far, please make sure you hit that like button and make sure that you subscribe, because of course I'm gonna have more information coming your way. Let's go. The other thing you want to do is you want to plan ahead for clinicals. Now I will tell you, it is an absolute headache to find a preceptor. Okay, I had a hard time finding a preceptor. It was a struggle. Okay, and the one mistake that I made when I was in NP school is that I did not network. You have to network, okay? You have to make sure you know people. Talk with the other NPs that you know or you see that are, maybe talk with the lead NP at your hospital. Like, network, get to know people, get out there. Why? Because when it's time for you to find a job, when it's time for you to go to clinicals, networking is going to be key. Because if you don't know anybody, how are you going to find anybody to precept you? Now, when I was doing the primary care adult gerontology program, now I was working in ICU. I knew 0 primary care physicians, okay? 0 primary care APNs. Now, if your school finds a preceptor for you, hallelujah. Okay, I'm gonna say that one more time. Hallelujah. For real, you don't know how much of a relief that is for you until you can't find one. So my suggestion is, make sure you start networking and try to secure a preceptor as soon as possible. Now, for example, if you're doing primary care, you can't do a rotation in acute care because you're primary care. They want you to do rotations in an outpatient basis because you're going to be caring for stable patients in an outpatient setting, right? Versus caring for patients that are acutely ill in an acute care setting. So you're going to have to make sure you find the appropriate preceptor on top of that in the appropriate setting. So you might find a preceptor, but if it's not in the right setting, you're going to have a hard time. So make sure you try to find a preceptor early. Make sure you network, okay? And try to pick an NP school that will find clinicals for you, because I can tell you, again, when you're looking for a preceptor and you cannot find one, this is when you will only wish that your school would have provided one for you. And that's super important. So the other thing too also is the quality of your preceptor. Now you might have a preceptor, but that preceptor just got you following them around. Like, what are you gonna learn? You're just following them around like a little puppy. It's like, hello, can I do something besides just walk around and follow you? Like, how are you gonna be able to learn how to make sure your differentials are on point, how to troubleshoot like an ABG, or someone's coming into the office, for example, and they're hypertensive, 190/80, young, 40-year-old that has no history of hypertension or history of anything. How do you treat that patient, right? So it's like you need to be able to do and not watch. And that's super important, because what's going to happen is if throughout your entire preceptorship, you're just watching, and then when you come out of NP school, you're going to be expected to do. And if you haven't been doing it while you were in NP school, then you're going to struggle. So you want your NP rotation to be very much similar to what it's going to be like when you practice, so that transition will be easier. And then if you have children, you want to make sure that you have daycare for these children, right? Because you remember, either daycare or either you have a family member or a friend that can watch them for you, because if you're doing outpatient, right, they're usually 5 days a week, 8 hours. So you're going to have to go in a little bit more frequently, right, to get those hours done. Now, typically, how much hours you have to do really depends on the school. Now, and it depends on the program. Like family nurse practitioners may have more hours because they're rotating between adult, pediatrics, women's health. Like they do a lot of rotations versus adult. You're just doing adult, right? So FNP may have more. So in general, it's between 600 to 1,000 hours. It really just depends on the school and it depends on the program, okay? So with that in mind, you're also gonna make sure you have childcare for those additional clinical hours. Now, and the last advice that I would give is start working on your DNP capstone early. I will say one of the mistakes I made, if you're doing a DNP program, because most of these programs are moving from BSN to DNP. It's no longer BSN to MSN. So that kind of throws you off. If you're not interested in getting your DNP, well then I'm sorry, because a lot of these programs are transitioning from BSN to DNP, so keep that in mind. So for me, I didn't want to get my DNP initially. I went to Fairleigh Dickinson and got my adult gerontology primary care certification, which took about 2 years. I worked and then I went back after about 2 or 3 years and got my DNP. Then I went back again. I'm always in school, oh my God. I went back again and got my acute care certification from UPenn. Now, I will say that when I was doing the DNP program, it was super stressful. Because I had a really stressful job. I was working nights, and I kid you not, I was on my feet all night, okay? Running around. And when I got pregnant the second time, when I was still doing nights, that's when it caught up to me, because I got preeclampsia. Because at this point now, you're pregnant, you don't have any other children, then you don't have to attend to another child, right? But then I got pregnant after my daughter turned 1. I was pregnant right after that month after. Now I have a 21-month-old and an infant. So I'm breastfeeding one, potty training the other. So anyway, besides that, before I had the baby, I was running around, not sleeping at night, barely sleeping when I am off, and running around with the toddler. And of course, I went to my appointment and my blood pressure was like 150 over 90. Started on meds, had to end up getting induced because I had proteinuria, so I ruled in for preeclampsia. I bled, had postpartum hemorrhage, and I was on blood pressure medication for 6 months. After I had my baby, I had to go back to the hospital when she was a week old, and they readmitted me because they said, oh, you're still at risk for preeclampsia. Oh my God, what a nightmare. So stress will definitely play a role in distraction from your work. And by the grace of God, I will tell you that I still graduated on time and I was able to complete that program. So with that said, it is not easy, but it can be done. Now, if there's any way that you could reduce your stress levels, you should consider that, because that will also affect if you're pregnant and going to school, because you don't want any complications like I had, and being on blood pressure medication for 6 months, Procardia 60 and Labetalol 400 BID with a blood pressure of 140 over 90, never hypertensive, okay? To be doing a job that's less stressful so you can rest and you can still focus on your work. So back to the DNP program. Now, one of the mistakes I made in the DNP program is that I chose a topic, and instead of using the literature to guide me, I tried to guide the literature. Let me explain. So let's say you want to do a project on heart failure 90-day readmissions, right? But instead of looking that up to see exactly what's out there on that topic, I'm trying to find articles and research studies to support what I want to do. Instead of just broadly looking up heart failure, right, and readmissions and just seeing what information comes to me, I can just use whatever's there and use that information to my advantage. So I wish like somebody would have told me this before. That would have saved me so much time. It was a waste of time, like looking and looking. Just put a topic out there and see what information comes to you. So if you have a lot of topics on something, then just use that and make your life easier. Trust me. The other thing that I struggled with was IRB. My project was sitting in IRB in the hospital forever. It never got through legal. Now, I will tell you, you want to pick a topic that can easily pass, right? IRB. Now, remember, if you're doing it in the hospital, you got to get IRB approval from the hospital, and you also have to get IRB approval from your school. So that's 2 IRBs you have to do. If you're doing it outpatient, then it is just your school. But if you're doing it inpatient like I did, just be prepared for 2 IRBs, okay? Oh my God. And if you're doing something, let's say, on patients per se, like it's an actual study where you're going to have to do an intervention on patients, they're going to have to evaluate, will this cause harm? Is this safe? Will somebody die as a result of this study that you're doing? It's a whole big nightmare. So the best thing for you to do a systematic review, okay? Pick a systematic review. Pick something pick a topic within the hospital that you feel that needs to be reviewed, and you can relay the results and say, as a result of this, for example, you say review your sepsis results. Are people starting antibiotics within an hour? Right? Are people given 30 milliliters per kilo of IV fluids bolus to the patient within an hour? And then what are the outcomes for that patient, right? Well, 70% of the nurses are giving this medication on time. The other 30% are not. And as a result, those 30% of the patients who didn't get it on time had higher mortality rates or had longer length of hospital stays. You can do that because you're not touching a patient. You're just going into the chart and you're reviewing the chart and coming up with information that presenting data that's already there. The data's already there, so you're not doing anything out of the ordinary. So do something like that. Don't do something where you actually have to do an intervention on a patient, because it will take forever for IRB to approve it, because they want to make sure that whatever you're doing is not going to kill somebody. Seriously, they don't want your study to be the result of some patient passing away. It could be something very simple that you think is not a big deal, but IRB will make it a big deal. Do a systematic review. I promise you, your life will be easier. Trust, okay? And once you do all these things, then you prepare for NP school this way, then I can tell you that you will be better off going in. If you assess your financial situation, go part-time if you can. Make sure you network, okay? Find a preceptor early that's appropriate for your program. And the DNP program, if you're doing that, make sure you work on your capstone early, because you won't be able to pass the school if you don't pass your capstone. So that is also another stressor that you definitely want to just get out of the way. And if you don't want to be bothered, then just go to a school where you only get your master's and you're not getting your DNP. If you don't plan to teach, if you don't plan to be involved in some sort of research, you probably don't even need it, okay? But just keep that in mind if you're going to go ahead and do the DNP program. I hope you enjoyed this video. Drop a lot of gems. Gems. You gotta catch all them gems, because I'm dropping them. Anyway, hope you enjoyed this video. Please make sure you subscribe, and I will see you for the next video, okay? Bye.